मेरा नाम है मोहम्मद जावेद, मैं लद्दाख से हूँ। मैंने श्रीनगर में इलाज किया, फिर मैं यहाँ फरीदाबाद मेट्रो हॉस्पिटल में यहाँ पे मुझे बहुत अच्छी तरह से ट्रीटमेंट हुआ। यहाँ का डॉक्टर सुमंत गुप्ता बहुत अच्छी तरह से मेरा ट्रीटमेंट भी किया, और यहाँ की जितने भी स्टाफ थे उन सब का बहुत शुक्रिया हूँ कि जिन्होंने मेरे बहुत अच्छी तरह से ख्याल रख के मुझे बहुत अच्छी तरह से ट्रीटमेंट किए थे।
Greetings to everyone. I am Dr. Sumant Gupta, Director Metro Cancer Institute. Recently, we had the pleasure of treating Mohommad Jawad. He was a young gentleman who came to us from Ladakh, suffering from a disease called as ETP-ALL. It is kind of a blood cancer which is very rare and a very aggressive form of blood cancer. So we initially treated him with some chemotherapy for a month or two, and once he stabilized and his disease came in remission, he underwent an allogenic bone marrow transplant. The beauty of these transplants are that the brother or sister who is completely HLA matched can give the stem cells to their siblings, and once these stem cells are given and the transplant is done, they can be free of the disease. So in a disease which has less than 5 or 10% survival otherwise, we can give them a cure rate of around 80 to 90%. So bone marrow transplants is something which is very important, which has to be understood, and especially in blood disorders and blood cancers, they play an essential role in the treatment. Metro Cancer Institute Faridabad is a pioneer in bone marrow transplants, where all kinds of transplants including autologous, allogenic, sibling, matched unrelated, RIC transplants are all being done on a regular basis. And I will like by this video to make you aware that we should not be scared of blood cancer, but we have to fight this disease to eradicate it.
I am Dr. Siddharth Sood. I am Consultant Medical Oncology, Bone Marrow Transplant and CAR T-cell therapy at Metro Cancer Institute Faridabad. Here we are dealing with a lot of patients with blood disorders, hematological malignancies, who often are referred to us in a state of quite discomfort and a lot of sickness. So I would like to tell you a similar story about a patient which I remember who had this condition called T-cell ALL, and it in itself is a very life-threatening disorder, and he was very hopeless when he came to us. We started the chemotherapy induction protocol and eventually started screening his family members for a prospect of transplant, and luckily his sister turned out to be a full 12-on-12 match, and he underwent a bone marrow transplant and had a turbulent hospital course and eventually came out of it, and today as we speak he is about 3 months post-transplant and is in complete remission and is keen on joining his normal life, which he may very well be able to in coming few days. Such is the story of victory over blood disorders and blood cancers, and which are made possible by the technicalities of bone marrow transplant and CAR T-cell therapies, along with the superlative care that our cancer center provides. And we are very happy for his recovery, and we wish him all the best. Thank you.